I'll be presenting briefly on the impact report that was written for the CBR department. If you'd like to see the report, you can scan the QR code here with your phone. You can use your phone camera and scan it. There should also be a QR code on the handouts that were available at the registration desk if you'd like to see it in more detail. And practices in the research we've conducted in the last 10 years, the research we've catalyzed and used our CBR framework in with our academic partners, any external research-like activities, any resources and toolkits we've developed, and research training and practices in the research we've conducted in the last 10 years that we've led. And this was to support 3 major goals for our report. Those being to measure the impacts of our department in both research and advocacy and how they serve both the mission of our department and Access Alliance. To determine if the CBR department is meeting the needs and addressing the priorities of the communities it serves, and to construct a set of sustainable goals for the department to guide and evaluate its evolution and future impacts. Currently, we're working on 7 projects. Which can be seen here on the slide and listed in the report itself. Of these, 2 are recognized as key projects for our department, those being the Canvas Data Collection Project, as well as the Hubs of Expressive Rights for Life, or HEAL program. Other key projects are listed on the next slide, which can also be seen in the report in more detail. And moving towards our research output and funding acquisition. Over the past decade, we have led over 46 research projects. 7 more have been proposed for 2025, with 11 past projects currently undergoing knowledge mobilization. In total, since 2015, we have funded and started 52 research projects in collaboration with 77 unique partners. From these projects, we've managed to publish 39 publications, which have been cited over 570 times across 21 unique journals with the voices of 105 unique authors. We've acquired over $2,480,000 in funding for our research since 2015. And if you're curious about the funding over the past 10 years, that's also available in the report. Regarding our knowledge dissemination efforts, we share our knowledge in a variety of accessible formats, digitally and physically, and as well as in multiple languages when possible. These materials support our outreach efforts and allow us to train community members to engage in our peer outreach program and guide our planning and evaluations for our past, present, and future programs. In the past 10 years, we've produced over 12 infographics, 6 toolkits, 42 blog posts, 21 presentations, and 8 videos, as well as many more different outreach materials. Our work has also been presented at a number of workshops, webinars, panels, and conferences, including the conference today. Most notable of these is a feature on the Tenfold podcast, as well as our presence in the 7th International Conference on Gender in Research in Barcelona, Spain, in April 2024. Moving towards the impacts. On the individual level, we're committed to meeting the needs of our community members, both inside our organization and outside of it, while strengthening their knowledge and skills. One of the things we do is collect client experience data and feedback data to further our goals of improving health outcomes for priority populations. Through this, we can provide satisfying, culturally sensitive, and client-centered services that are equitable, accessible, and relevant to all members of our community. We're also committed to driving positive change through the process of research itself, which can be seen in our talent development initiatives. We are dedicated to fostering the development of staff, students, and researchers within our department. Our dedication extends to our Immigrant Insight Scholar program, as well as our Immigrant Research Support Network initiatives, which you can read more about and highlight in the report. Within the past 10 years, we've hosted 8 IAS cohorts, within which we've trained over 25 fellows. We can firmly say that this initiative has left a positive impact on our fellows, as you can see in their stories within the report. We also offer opportunities for students to complete placements in our department, where they can get tangible experience in the research field and begin to build a written legacy for their future academic and professional pursuits. And since 2015, we've trained over 90 placement students, including myself. We also developed and published many toolkits, conduct training, and give presentations to further share our knowledge. Within the past 10 years, we have developed 6 toolkits and conducted training sessions and presentations over 64 times. We're also very dedicated to impacting the communities we serve as well. So we work hard to make sure that we have a strong web of formal partnerships with academic institutions, other community health centers, community partners, and public health agencies of Canada, as well as many more. Between 2015 and 2025, we collaborated with 77 organizations, 120 times over 52 projects. We also try to have a great impact on our community through our research as well. One of our most notable impacts is our advocacy for and inclusion of communities and their members in research through our training of and collaboration with peer researchers, as well as our CDR training efforts, which you can read more about in the report. As mentioned earlier, our department has also developed 6 toolkits in the past 10 years, brief summaries of which can also be found in this appendix. Notably, our department has contributed to the methodological literature on systematic review models, knowledge creation, expressive arts therapy implementation in research, and the inclusion of peer researchers and internationally educated scholars in research. This includes publications and workshops, as well on the local, international, and international levels. Notably, our department has also contributed to the social prescribing practice paradigm, which has been defined in very much detail over this conference. This client-centered approach to practice has gained significant traction in the community health sector, and we intend to continue using it in all of our programs moving forward. On the systems level, we also try to have a significant impact on advocacy efforts in our key fields of interest. Within the past decade, we've tried to contribute to a legacy of action that we hope to continue with our organization's evolution. One of our organization answered the call to action and joined the Status for All campaign in 2022, within which one of our most unique contributions was the collection of 125 handwritten stories from undocumented individuals in Toronto, many of which being our own clients. We were able to publish these as part of a book and display them in a gallery, the experience of which you can read within the report as well. While the fight for Status for All is still ongoing, the movement has led to positive policy changes for migrant workers, which is one step of many towards Status for All. We also collaborated with the Internationally Trained Physicians Access Coalition, or the ITPAC, helping to place trained physicians in workplaces. The pressure placed on the government from the ITPAC's advocacy, specifically addressing the shortage of health professionals in Canada, as well as the neglect of internationally trained physicians, helped actually to lead to a policy change in the Ontario government's plan to stay open, health system stability and recovery report. Our department is also dedicated to understanding the unique healthcare needs of our priority populations and identifying the unique challenges that they face when seeking and accessing care. Our research, both published and internal, has aided the development of several of our programs and worked to help us create high-quality and accessible programs for the communities that we serve. Lastly, our Canada's project, which was started in 2023 in collaboration with the Public Health Agency of Canada, as well as 3 other community health centers, has generated international interest from researchers in other countries. With this project, we were able to lead training initiatives on how to ethically conduct CDR for the collection of sensitive data from sensitive populations. Plans for further countrywide knowledge mobilization continue, the impact of which we look forward to observing as well. More on this project can be found in the report as well, and a highlight, including a testimonial from one of the IS scholars who worked on it. To conclude, the following goals for our department, again outlined in the report, were created with the help of input drawn from the testimonials of several of our IIS fellows, laying the foundation for the department's evolution. With the sustainability and improvement of our department services in mind, we've outlined the following goals and objectives for our future. Through centering these goals in our work, as our organization and department continue to evolve, we can ensure that we continue to leave a lasting impact on the communities that we serve, and continue to support learning in our pursuit of change and innovation in the research sector. And If you're curious about any more of this information, it's always given me in my